What what would you do if your pharmacist told you your prescription cost today is $594? That is the retail price of 1 month's worth of Eliquis. Eliquis is a brand name blood thinner medication that treats and prevents blood clots that can lead to stroke. Today, I aim to persuade you that even though some of these medications have outrageous costs, restricting the costs would cause more problems, and there is a better solution. My name is Tiffany, and today I will talk to you about this question: should the government regulate prescription drug cost? As a pharmacy technician of 3 years, I have seen firsthand how the cost of some medications can frustrate people, anger them, and even drive them to tears. This life-saving medication costs as much as some people's monthly grocery budget. Imagine having to choose between eating and staying alive. With these high costs, it's understandable why some people may be upset. Many people ask me, why is it so expensive? About a variety of medications. Another one that has been in the news lately is Ozempic, which is an injectable drug used to treat diabetes and obesity. It's $935.77 without insurance, just for 1 month. That's only 4 injections because they take them once a week, so that's 4 injections for almost $1,000. For a frame of reference, a common prescription called amoxicillin, which is an antibiotic used to treat common infections, costs less than $20 retail at Walgreens at the time of this recording. But making the government cap the cost of expensive medications is not the answer. And there are 3 reasons why this is true. When it comes down to it, government regulations on drug prices would hinder drug production, innovation, and quality. Restricting the prices that drug manufacturers can charge is like rejecting capitalism, and that is a big problem. The reason why many of these life-saving drugs exist is because of these high costs. There are real people, scientists, behind these medications conducting research and working to make sure they are safe. This issue reminds me of the Heinz dilemma. And for those of you who aren't familiar with it, I will describe it briefly. There was an American psychologist, Lawrence Kohlberg, who created a story to analyze morality. The story goes that a man called Heinz had a wife that was very ill. A chemist created a drug that could save her life, but was charging 10 times what it cost to make it. In the end, Heinz could not afford to buy it, so he broke into the chemist's laboratory and stole it. As a one-time situation, most people may sympathize with Heinz and say his wife needed it more than the chemist needed the money. But what if the scales increased? If Americans collectively decide to force drug manufacturers to lower their prices, we would have millions of Heinzes refusing to pay the cost and essentially breaking in and stealing the medications, causing nationwide shortages. We have already experienced a situation like this with the Adderall shortage of 2020. Adderall goes by many different names generically, but it is a brand name drug that is used to treat attention deficit hyperactivity disorder. And according to a study published by the CDC in 2023, among males, which were the sex most diagnosed with ADHD, stimulants like Adderall were prescribed to 23.7% to children between the ages of 5 and 19. And just 9.7% were prescribed to the age range of 20 to 29, with other prescriptions being distributed more evenly across age groups. So a significant portion of these prescriptions were prescribed to children. Whether or not you agree with giving these types of medications to children, I think we can all agree that if a qualified doctor, prescribes a medication to a child, it is the responsibility of all of us as adults to make sure that that child is able to get it. And in 2022, we fell short of fulfilling this duty when the FDA announced the shortage of Adderall. I saw firsthand the desperation in parents who went from store to store trying to get their child's medication because they could not function in school without it. They went desperately from one pharmacy to another, having to beg their child's doctor to write them a new prescription every time, because that was what they had to do to comply with the DEA regulations. And a possible reason for the shortage may have been that manufacturers simply did not profit enough on these medications because they were generic, so they were low cost. And the more expensive medications, the brand name ones, were in full supply for much of this crisis. If they were not making a profit, perhaps they were simply not motivated to make them. As in the Heinz dilemma, it seems that many Americans expect companies to make and sell these medications just out of kindness, and forget that healthcare in America is a business. For better or worse, it is motivated by profit, by money. David Gaw, an interim CEO of the Association for Accessible Medicines, was quoted as saying, "The generic industry used to lose money on about a third of the drugs it produced, but now it is more like half. I propose that instead of having the government intervene with pricing of brand name drugs, which would inhibit competition, lower drug quality and safety, and stall innovation, we must pass the Affordable Drug Manufacturing Act of 2023. This bill, S3398, is the Affordable Drug Manufacturing Act of 2023, and it aims to get approval from the FDA to have the government manufacture common generic medications like insulin, asthma inhalers, and antibiotics that big companies may not be motivated to produce, or may even, as David Gaw put it, be losing money to make them because they're so cheap. It was introduced by Massachusetts Democratic Senator Elizabeth Warren in December 5th, 2023, and it could increase availability of these drugs, helping to prevent events like the 2022 Adderall crisis, which affected millions of children, and also decreased the cost to taxpayers by cutting out the middleman between the patients and their Medicare or Medicaid drug plan that's paying for their medications. The independent drug manufacturer would be that middleman. Passing this bill is a better alternative than restricting drug prices because it would lower the prices without impeding competition. Passing the Affordable Drug Manufacturing Act of 2023 would be like having the government step in the case of the Heinz dilemma, and sell to Heinz at an affordable cost. The chemist would no longer be a victim, but can choose to compete with these lower costs and still earn a profit. With the Affordable Drug Manufacturing Act of 2023 passed, American taxpayers will see less of their dollars going to drug manufacturing companies while preserving their access to new innovative drugs. With the lower costs of government manufactured drugs, you can expect that if your doctor writes you a prescription for one of those medications like insulin, like asthma inhalers, you will not be stuck with a crazy high bill. If Americans do decide to pass laws that limit money drug manufacturers can charge, at the pharmacy you may hear this: "We haven't been able to get that drug in months." Possibly because drug companies are not even motivated to produce it, or even that drug has been recalled and is not available. That could happen because companies were forced to cut costs and take shortcuts and ended up producing a drug that was not safe and had to be recalled. What you can do to ensure these life-saving medications remain available to children and adults of all ages is to help get the Affordable Drug Manufacturing Act of 2023 passed into law. In case you may not know how to do that, here is how. Writer Karen Suhaka, in her 2017 article titled "So You Want to Take Action," recommends using the following steps to participate in getting a bill passed. You can research and find out who your state legislator is, call them, and let them know that you're a constituent. Let them know what bill you're calling about and what you think about it, and any personal experience you want to share about it. And then make sure that you keep it brief and concise. So what's my point? Although many prescription drugs today come with sometimes devastating sticker shock, government control on these prices is not the answer. It would impede competition, hinder availability, quality, and innovation. A better solution for all Americans that want lower drug prices is to call your legislators and have the Affordable Drug Manufacturing Act of 2023 passed into law and allow government to step in and produce these low-cost, life-saving generic drugs. You can help to make sure every American always has access to life-saving medications and help ensure that innovative discoveries in medicine continue to be made into the future.